Hello, good afternoon. My name is Bojo. I have my audience here with me. She's the one recording.
Hi.
I have a presentation for my speech 2011 and information speech topic diabetes mellitus. And I have my students here with me. And I hope before the end of this class, you'll be able to understand diabetes and the signs and symptoms of diabetes mellitus. Diabetes mellitus is a disease associated with high blood sugar in the system. When your pancreas is not able to regulate the glucose in your body, and it can lead to a diabetic. You'll be diabetic. So we have two types of diabetes. Number one, type 1 diabetes, the early onset, and type 2 diabetes, the adult onset. And I'll be talking about the signs and symptoms of diabetes mellitus. Number one, signs and symptoms of diabetes mellitus is excessive urination. Number two, feeling hungry or tired. Number three, excessive sweating. These signs and symptoms of diabetes can happen, can show like slowly, or some people they don't know about it. And type 1 diabetes can only be treated with insulin, whereas type 2 adult onset diabetes can be treated with insulin and prescribed medication by a physician, doctor, or the primary physician. Diabetes mellitus is a disease rated in 2007 as number 7 killer in the United States. Diabetes mellitus in WebMed, according to WebMed, or on Diabetes Resource Association, says approximately 26 million people are suffering from diabetes, and 6 million people are pre-diabetes, and some million people don't even know they have diabetes. And looking at this in a perspective of economic perspective, they spend 126 billion on diabetes mellitus to maintain people having diabetes, to regulate, to help them. And if we can have one way or the other to use our medication, exercise regularly, eat healthy, that will be able to cut our expense on spending money on diabetes mellitus. The diabetes mellitus is a disease which can show slowly or can appear that you won't know about it. And when they prescribe a medication for you, it's advisable for you to use it regularly. And if you're on glucose check, or maybe on Q4 or Q6 or Q2 hours, check your blood sugars often, because you can have the high blood sugar and you can have the low blood sugar once you're diabetic. And we can be hypoglycemia, the low blood sugar, and you can have the high blood sugar, the hyperglycemia. It's good to check your blood sugar, glucose every time. And in the dietary aspect, you have to exercise regularly, eat healthy to maintain your body. And I've realized that research have shown that people that have diabetes, the type 2 diabetes, are the people that are obese, the adults that are obese. Obese people, they have diabetes. And when you see the signs and symptoms of you are obese, you have able to reduce your weight and able to exercise to maintain yourself. And diabetes mellitus is a disease that we don't have to joke with. So I will advise you to maintain yourself, use your drug regularly. I'm a witness of diabetes. I have a witness for diabetes mellitus. I have a cousin that died of diabetes. He suffered with diabetes, struggled with diabetes for 15. He had diabetes at the age of 15, and he struggled with diabetes for 15 years. He died at the age of 30. He just got back from work and he had convulsion and he died. He passed away. So since then, I've seen the risk, and I've seen the problem. I've seen the signs. I've seen the problem with diabetes. That is a dangerous disease. It's a lifelong chronic disease that we shouldn't joke with. And I hope with all the discussion, the information I have for you, you can be able to see the effect and the signs and symptoms of diabetes mellitus. And my work cited, our work cited was taken from American Diabetes Association, glucose, http://www.diabetes.org, diabetes/treatment and care control checking your blood glucose, February 7, 2013. My second work study was taken from American Diabetes Association, Choose to Live Society Diabetes Survivor Guide, 2013. Thank you. Have a wonderful day.